Hi, so I'm Upma. I've got this study through which we are trying to see how does health system support advanced care planning with diverse communities in Australia, which is especially in regards to planning of advanced care planning. And we've got advanced care planning means that what are your wishes and preferences towards the end of your life? How would you like to be treated? Where would you like to be? Whether you would like to be at hospital, would you like to be at home? Would you like to be resuscitated? Those kind of planning is called advanced care planning. So with this one, we are trying to see what are the available resources in Australia which support advanced care planning specifically with culturally and linguistically diverse communities, and what are the specific practices are being used to engage this population. So what we used a document analysis approach for this study, and what we found was among hundreds of documents that were available for general population, there are only 31 documents available for CALD people. So out of which we've got 16 documents which were available in multiple languages, which were a large number of 91 community languages. And we've got only 10 documents which were actually speaking about how to engage CALD communities while planning for advanced care. And we also saw that most of these documents came from government sources rather than NGOs, and a big number, which is about 60% of them, were at state level rather than at federal level. So, moving on, while analyzing the 10 documents which had some recommendations for CALD groups, we found that they had a number of steps that were the recommendations on how to engage these populations. So we've got things like practice culturally sensitive and person-centered behavior or care, support communication needs, engage bicultural workers, connect to appropriate support person, provide opportunity and support to discuss their wishes and preferences, developing cultural awareness and competence of healthcare staff, establishing collectivist versus autonomous approach, and to practice trauma-informed care. So our conclusion was that we have a large number of these documents which are available in languages. Actually, only 10 of them have some recommendations. Others are only mere translation of the original English documents. And we need what is among these 16 documents which are there in other languages, are they considering cultural relevance at all? It can be a good next step for research. And our next steps is we want to see these themes that have come out from the 10 documents. Where do they lie within a consumer engagement framework? So consumer engagement framework starts from informing the consumers, collaborating with them, or involving them as equal partners, something we call shared decision making. So it's increasing level of consumer participation. So we are going to be classifying these themes on that spectrum and see where they lie and how far these resources are working to engage these populations. Thank you.